Hi, in this video I'll be talking about stage 2 breast cancer. I'll start by explaining what stage 2 breast cancer is, then I'll talk about the different treatments and how we make decisions about treating stage 2 breast cancer. So stage refers to where the tumor is in the body, the size of the tumor in the breast, and then the number of lymph nodes or lymph glands under the arm that have cancer in them. One can have a stage 2 breast cancer just based on tumor size alone. If the tumor is bigger than 2 centimeters, it's only about this big, so 2 lima beans end to end, that's a T2 tumor, and that makes the tumor stage 2. You can also have a tumor with a smaller tumor size, but the lymph nodes are positive. 1 to 3 lymph nodes positive mean that this is a stage 2 tumor, regardless of how small the tumor is. When we make treatment decisions about stage 2 breast cancer, we look at things other than just the size of the tumor and the lymph nodes. So if you've been told you have stage 2 breast cancer, that's actually not a lot of information for you in terms of the type of treatment you'll be offered. So let's start with how things usually go. Usually people get surgery first, then chemotherapy with or without targeted therapy. Radiation therapy will be offered to many patients, and we also give hormonal therapy. So I've mentioned all the different treatment types, and then the biology of the tumor helps us make decisions about what type of treatment we consider. When you have surgery for stage 2 breast cancer, depending on the size of the breast and the size of the tumor, you can very likely keep the breast, meaning you don't have to have a mastectomy, which is removal of the entire breast. In other words, you can have a lumpectomy, where we remove just the tumor itself. Now, if you can't feel it, how is it a lumpectomy? Well, we'll call that a wide local excision if the tumor can't be felt. So if you have a small breast and a larger tumor in a small breast, a mastectomy might be the best thing for you, removal of the whole breast. Here's another option. You can have chemotherapy first to shrink the tumor, and then it might be possible for you to have a lumpectomy instead of a mastectomy. So if you hear about getting chemotherapy before surgery, we're trying to shrink the tumor as well as treat the rest of the body, which I'll get to in just a second. So depending on the number of lymph nodes involved and the type of surgery you have, you may be offered radiation therapy even if you have removal of the breast. So we recommend radiation therapy after mastectomy in people who have 1 to 3 positive lymph nodes. So just having a mastectomy doesn't mean you'll need radiation therapy. If you have stage 2 breast cancer and the lymph nodes are negative, you'll have radiation therapy if you have a lumpectomy, and not necessarily if you have a mastectomy. There are always exceptions, and I won't go into those now, but you can read more about those on our Yerbba blog. So we talked about surgery and then who would get radiation therapy. If you're a candidate for chemotherapy, in other words, if the biology of your tumor, the personality, if you will, indicates that chemotherapy will work, you'll actually get chemotherapy before radiation therapy. Chemotherapy decisions are made on the basis of not only the stage, but the biology, and I'll just briefly describe those here. If the tumor is estrogen and progesterone receptor negative, we are more likely to recommend chemotherapy. That means there's no hormone receptors on the tumor. Chemotherapy is more likely to work. If the tumor is HER2 positive and has this protein or expression of the gene for HER2, human epidermal growth factor receptor, we're more likely to recommend chemotherapy. We also give targeted therapy in that case. If the tumor has a higher grade, that means the tumor is more active and looks more disorganized, we're more likely to give chemotherapy. And, as I mentioned, if the lymph nodes are positive, you're more likely to get chemotherapy. There's also a special test called a multi-gene tumor assay. That means your tumor is sent to look at its personality in more detail. We only do that in tumors that are HER2 negative and lymph node negative and ER positive, estrogen receptor positive. If that risk of recurrence score comes back low, you won't need chemotherapy. If it comes back higher, chemotherapy is more likely to work. So I've talked about surgery, radiation therapy, which follows chemotherapy. I've talked about chemotherapy, and I mentioned targeted therapy, so I'll just tell you a little bit about that. Targeted therapy in stage 2 breast cancer includes trastuzumab, the brand name you may have heard is Herceptin, and pertuzumab. The brand name you may have heard for that is Perjeta. If your tumor has the HER2 protein or overexpression of the gene that makes HER2, we will give targeted therapy. Targeted therapy usually goes for up to a year, depending on how you're doing on it. Chemotherapy along with targeted therapy, and then you finish out that year of targeted therapy. Hormonal therapy decreases the amount of estrogen getting to any residual cancer cells in the body. It doesn't always lower estrogen, but some of the medications do. And this you'll take for 5 to 10 years, depending on how you tolerate the medicine, and also features of your tumor. That's a decision you and your doctor will make. So there are lots of different things to think about in treating stage 2 breast cancer. I talked about a lot of different treatment types. What I'd like to do now is go through each treatment, what you can expect when you get these different treatment modalities in terms of what to expect on that day of treatment, over the whole time, and then side effects and how you might manage those. I'm also going to cover costs, because costs of treatment are very important and things you may not have heard about or think about when a certain treatment's recommended. So we talked about surgery, and that'll be covered in another one of our videos. But basically, surgery, unless you have reconstruction following a mastectomy, is a one-day procedure. So it's outpatient most of the time. If you have your lymph nodes removed because they're positive or because we want to figure out if they're positive, the recovery time's a little bit longer because you have an incision under your arm. And what you'll find with that is your range of motion is a little decreased. Don't be afraid to ask for a physical therapy consultation to try to improve your range of motion as soon as possible. What to expect with chemotherapy. Chemotherapy is given as an outpatient in a treatment center. We're trying to treat cells that may have escaped the tumor before you were even diagnosed and spread to other parts of your body. What that means is that we give treatment to go through your whole system, and the best way to do that is through a vein. So if you're getting chemotherapy, this is what it looks like. You've already had your consultation with the kind of doctor that gives chemotherapy, called a medical oncologist, or just an oncologist for short. You'll understand what treatment will be given to you and what to expect, but I'm going to give you a little bit of a preview. You will go to the treatment center. Again, this is all outpatient. You'll have an IV put into your arm, usually on the side other than your surgery, or you might have a port, which is a semi-permanent IV that goes under the skin on your chest. You don't need a port unless your veins have been difficult in the past. Most people don't need to get a port. It's one more procedure and it leaves another scar. It's a pretty safe procedure, but again, wouldn't it be nice to avoid that? When you get to the treatment center and they put that IV in, the pharmacist or nurse will create your chemotherapy based on your height and your weight, so it's specialized for you. It's different for every person, and then that medicine will go into the vein after you've been given some other medicine to decrease the risk of side effects, specifically nausea and vomiting. So those medications you'll get before you get the chemotherapy. The chemotherapy will go in either as an IV push through a syringe, a small bag, or a larger bag over a longer period of time. The very longest chemotherapy is 6 hours. Most chemotherapy is much shorter, but I tell my patients, plan to be there for a whole day. That way you're not planning things you have to get to right afterwards. We do recommend you have a driver for your chemotherapy, not necessarily because of the chemotherapy, but the medicines we give to prevent side effects can make you a little drowsy. Also, getting chemotherapy is a big deal, and you don't want to be driving after such a major event in your life. Once the chemotherapy is over, the IV comes out of your arm or the port, and you go home. The costs of chemotherapy are usually covered by insurance. You may have out-of-pocket costs for the medicines that you take at home to prevent nausea, both before and after chemotherapy. So it's important to talk to your doctor about the cost of treatment. Side effects of chemotherapy, they're different for everyone. And if you want to learn more about this, you can go to your personalized Yerbba report to learn more about the chemotherapy you might be given and what to expect. But in general, I tell people to expect some fatigue, and that actually gets worse with each treatment. Ask for help with things that you can ask for help for. We also see hair loss with most chemotherapy, and it's something to talk about what to expect. We also have another video about hair loss with chemotherapy that goes into this in much more detail. That can be one of the hardest things with chemotherapy, is losing your hair. We also see low white cell counts, which means that you may get a white cell booster along with your chemotherapy the following day, and that keeps your white cells up so that you can stay on track with your chemotherapy. And there are other side effects that different people can get. Mouth sores are pretty uncommon. If you have darker skin, let's say you're a black person or of Mediterranean descent, you may notice some darkening or spots on your palms, darkening of the nail beds, and even darkening of the tongue and gums. That all goes away after chemotherapy, and your hair will grow back too. So I've covered how chemotherapy is given, what to expect, side effects, and some of the costs of treatment as well. Next, I'm going to talk about radiation therapy. If radiation therapy is part of your treatment plan, you will first have something called a simulation. That's the longest appointment. In that appointment, the physicist and the radiation oncologist, the type of cancer doctor that gives radiation therapy, will work very carefully to make sure that radiation is given to the areas that need it. For example, the breast, in particular chest wall if you've had a mastectomy, and the neighborhood lymph nodes. What we try to do with that planning is use a CAT scan to make sure we only radiate the areas that need radiation therapy and not the normal tissues. So you can understand why it takes a long time. We want to get this right. Now, after that simulation or treatment planning appointment, your radiation therapy is actually much shorter than, for example, chemotherapy. Radiation therapy, you'll be in and out. You'll come in, you'll change into a gown, you'll get your treatment and go home. It takes about as long as getting an x-ray or a series of x-rays. You can drive yourself. There is no nausea with radiation therapy. So we don't give you medications before radiation therapy. So what about the costs of radiation therapy? The radiation therapy is covered by insurance, but if you have a high deductible plan, it might make sense to see if you can get all your treatment the same year as your surgery and chemotherapy before the next calendar year kicks in and that deductible starts all over again. Radiation oncologists are used to questions about that. What you want to avoid is any delay between chemotherapy, for example, and starting radiation therapy. Try to get your usually 6 weeks of radiation therapy in before the end of the calendar year. Side effects include some fatigue, which, despite the fact that it's not going through your whole system, radiation therapy can cause. You'll also notice skin changes where the radiation is, so around the breast and the lymph nodes. You may get some burning, some pinkness. It may actually be bad enough that your skin sort of comes off. Talk to your radiation oncologist and the nurses about those side effects, because we do have ways of decreasing the pain or discomfort. Serious pain is pretty rare. This all goes away and starts to heal about 2 weeks after the end of radiation therapy. If you don't have a lot of skin side effects, don't worry, it's still working. You will not get hair loss with radiation therapy to the breast and surrounding areas. Okay, targeted therapy, which again we give along with chemotherapy, goes for a year. Your first treatments will be along with the chemotherapy, and after that, when chemo is done, you'll finish out a year of targeted therapy. It's given the same way chemotherapy is given, through a vein, and now it's given every 3 weeks once the chemo is over. Before that, we try to time it along with your chemotherapy. Targeted therapy side effects are much less than we think about with chemotherapy. Your hair will start to grow in, your fatigue should get better, you're still a patient, you're still being seen in the treatment center, you won't see your doctor as often, which is kind of nice, and the treatment course is a lot shorter, so it doesn't take as long. You can drive yourself most of the time. If you have a reaction to targeted therapy and we give you medicine before your targeted therapy, you may want to have a driver. Talk to your oncologist about that and to the nurses. The last thing I'm going to talk about in terms of what to expect is with hormonal therapy. This again is given to people whose tumors are estrogen and or progesterone receptor positive. Hormonal therapy is given as a pill, and you take this once a day for 5 to 10 years. There are several different kinds of hormonal therapy, but basically what these medicines do is block the estrogen in your body, whether you're pre or postmenopausal, from getting to any residual or remaining cancer cells in other parts of your body. Side effects with hormonal therapy depend on which drug you get and depend on you personally. But basically, the sort of top ones we talk about are hot flashes or night sweats. People with tamoxifen can get leg cramps. We also think about sexual side effects such as vaginal dryness or discomfort. And then finally, there are rare but serious side effects which differ according to the drug. So tamoxifen rarely causes blood clots in the legs and rarely causes an increased risk of uterine cancer, cancer of the uterus, endometrial cancer. Again, it's very rare and it's caught early, but it's something to know about. If you don't have a uterus, not something to worry about. With the aromatase inhibitors, which actually decrease the amount of estrogen in your body by blocking production of estrogen, the side effects you should know about with this are thinning of the bones. Without estrogen in your body, your bones can get a little thinner. Now we have ways of treating you and monitoring for that, which we'll go over in another video and that you can see on our Yerbba blog and also in your personalized Yerbba report. But this is important to know about. The other thing is there appears to be a slightly higher risk of cardiovascular disease with the aromatase inhibitors. So that's something you'll want to be followed for. If you have a high cholesterol, get that treated. Exercise, do all the right things you can for your heart, regardless of whether or not you've had breast cancer. The costs of hormonal therapy are covered by insurance. If you can't afford your medicine, you can ask your doctor or the rest of your medical team to help you get patient assistance, in which the pharmaceutical companies will actually provide the medication to you at a lower cost. The generics are just as good as the brand name, so ask for the generics. The generic version of the medications. They're a lot less expensive. If you get side effects or if you have concerns about cost with hormonal therapy, talk to your team. It turns out a lot of women come off hormonal therapy because of the side effects I told you about and never tell their doctor. In fact, they may not even return to their oncologist's office. Hormonal therapy is essential in the treatment of hormone receptor breast cancer. A lot of people think, I've been through chemotherapy, I've been through targeted therapy, surgery, radiation therapy. Hormonal therapy is not that important. It's actually in many cases more effective than chemotherapy or targeted therapy. So do make sure you've done everything you can to stay on it and work with your doctor. If you're not tolerating one medicine, we can switch to the other. If you're going through treatment for stage 2 breast cancer, you can learn more about your own treatment, remember, at your own personalized report on Yerbba.com. And if you'd like this video, why don't you like it and subscribe so more people can find it?